One of the problems with this latest confusing guidance, I have to say, on whether individuals who have tested positive should get a COVID test before they leave isolation. Isolation went down from 10 days to 5. I have to say, it's that this part isn't necessarily her fault. They were asked, CDC was asked, should somebody take a test? And CDC ultimately said, well, that's up to you. But the truth is, we have a testing shortage. We don't have enough tests in this country. And that's not Dr. Walensky's fault. That's the Biden White House's fault. They promised that they were going to have tests everywhere for everyone whenever we needed them. And we're not there. And you yourself have experienced the frustrations of that shortage. Is it possible that part of this is also Walensky taking blame for Biden blunders?
Well, I think that if we were in a situation, Jake, where there was an unlimited supply of tests, we probably would say, reduce to 5 days and test coming out to make sure that someone still isn't positive. But that's not the situation that we're in. And it's very important that you have tests to determine up front who truly has COVID. And so without that, I think that this is the right outcome. The challenge is that when someone says, well, okay, but what if I do test? What do I do? And the guidance coming out was, well, then you should probably continue to stay in isolation for another 5 days. That leads to very mixed messaging. But I think your point is right. If there was an unlimited supply of tests, what would we do? And I think we would ask people to test to know that they're negative coming out. The critical piece there, though, is that people are most contagious early on, and with each day after that, the likelihood of you transmitting will go down. And so some people will be able to transmit, but most people after 5 days will not.
So anyone on social media, especially Twitter, knows that the CDC has become the butt of a lot of jokes over the last week. There's a series of memes joking about what the CDC might recommend next. An example might be, that we've seen. The CDC says you can now run with scissors. Or there's another tweet also resonating with a lot of folks that captured the frustration of the moment. Quote, stay indoors, but also return in person. Wear a mask. Not that one, the expensive one that you can't find. Take rapid tests, which you also can't find. But if you find them, don't buy them. Rapid tests don't work. You need PCR. There are 0 appointments in your area, unquote. You worked at the CDC. How do jokes like that land inside the building?
I think they sting. The current CDC director inherited a situation that I wouldn't wish on my worst enemy. And that's coming in the middle of a pandemic after a period of time where public health was vilified. Public health was lifted up as the barrier to the end of the pandemic, as the enemy of our economy. And so coming into a situation where the nation is polarized and trying to reassert the importance of following the path of public health, it was an unthinkable challenge to be addressing. And we're seeing how hard that actually is. I hope coming out of this, as a nation, we're committed to supporting our public health systems, our federal system, our state, our local. As you've seen across the country, hundreds of public health leaders have left because of how they've been viewed and treated within their communities. And that's going to have a long-lasting impact on the health of our nation.